Hi, this is Paula.
And I'm Joseph, and you're listening to Life Lived Better. How was your
Right.
weekend?
It was good. I got a lot done. Went up to campus. I'm getting ready to go back to school soon. So went up there and just did a little bit of work. And other than that, just a little bit of hanging out at the house.
I can't believe it's already time for you guys to go back.
I know it feels like summer hasn't even. I didn't get the vacation part now. It definitely weather-wise feels like summer is here. This over 100 degree has got to go.
It's awful. Like 100 degree. I think it's been more than, has it been 2 weeks over 100 degrees at this
And
point? Yeah.
about 2 months since any significant rain. I was sitting here one morning this weekend and heard thunder outside. I was so excited. I looked out the window. I was like, make sure it's not like something going on next door. Make
Yeah.
sure it's really thunder. And we got like 5 drops of rain.
Yeah.
Then it was over.
We were at our friend's pool on Saturday, and while we were in the pool, the wind blew through and like it started thundering, and so we got out because we felt a couple of drops and nothing. It was just a teaser.
It is sickening. It is. It is. And I'm sure this winter when it's cold, I'll be wishing that it were warmer, but it's at Texas, there's such extremes. There's no,
Hmm.
temperate. It's not going to be just a nice calm 70 degrees here. Not often.
Right. It's all part of the Texas charm. You get
Mhm.
all the seasons in 1 week.
Yeah, exactly. Exactly. I know I was looking at clothes. I like to go before the school year starts. I feel like a school kid, get a couple of new outfits for the year, and I couldn't even bring myself to look at anything for fall because it was like they have sweaters out. I'm like, I couldn't look at sweaters. I know I'll need one soon, but I couldn't look at sweaters when it's 110 degrees outside.
I bought a long sleeve shirt last weekend. It was on clearance and it was cute. So, in anticipation of the cooler weather.
That maybe I'll make it come.
Yeah.
I'm hoping for a little rain.
Yeah, it
Well,
did rain here a little bit on, I don't know if that was Saturday or Sunday, but I went and washed my car.
oh,
And
yeah,
of course that night it just enough to like get the car dirty, little
yeah.
sprinkles. Yeah.
Yeah, maybe I'll go wash mine so we can get a little bit here.
We should both go wash our cars and
There you go.
double our chances.
I'd like some. Just my lawn. My lawn needs a little rain. My neighbor who has had the most beautiful lawn I've ever seen, and there's never a weed out of place. They're even getting some little brown patches in their lawn. So
Yeah.
I know if their lawn's suffering, it's ugly out.
Yeah, I just did a couple of repairs on my sprinkler heads this morning, and I thought maybe that was why ours was not very green, but it's just hot and it's just
Yeah.
crunchy and
Hmm.
brown
Yeah.
and some really green patches right around the sprinkler heads.
Yeah.
But other than that, nada.
I've read and I've been told by some landscaping folks that even if you water every day at this point, which you're not supposed to,
Right.
um, it wouldn't make that much of a difference. It's just that hot.
Yeah, I believe it.
Are y'all on any kind of water bans?
No, not that I know of.
Yeah, not us either. I'm surprised.
Keep it to a minimum though with our sprinklers. I just run them a couple times a week. So
That's what
at
I
this
read. You're
point,
supposed to. It's,
yeah.
you know,
So our topic this week, what are we talking about?
we are talking about trauma. About it's a big topic. I think. I think we're hearing that term a lot more than we used to. But I
Hmm.
don't know that we fully understand what trauma is when people say that, that term, when they use that term. And
Hmm.
so we, in the addiction counseling world, we're required to know about trauma and we're required to be informed. They call it to be trauma informed so we can screen our clients to see about the trauma in their background because there's so much evidence that addiction is a result in many people of childhood trauma. And
Mhm.
so we probably know a little more about it than the average person. So I thought that would be important for us to share with everyone.
Definitely. And I think talking about the different types of trauma is important, and understanding, like when I think of trauma, used to I would think of, just crisis situations, like major, I would think of, like when we talk about PTSD and things like that, I think of worst case scenarios, like people that have gone off to war and,
Hmm.
but the truth is PTSD can happen with any kind of trauma, a
It
car
really can.
accident or, childhood issues. Like
Hmm.
it's something that I'm seeing too that's more and more frequently diagnosed at this point.
Hmm. Yeah. Thank goodness. I mean, thank goodness we're understanding it a little bit more. I don't think it means that there are more people being traumatized as much as that we're just finally understanding that it can be a result of so many different things.
Hmm.
And there are three different types of trauma, which I think is important for us to identify because it's kind of on a continuum. There's acute trauma, and that's like the emotional experience we have while the event's going on or kind of right after it. And then there's chronic emotional trauma, and that's the long-term response. So there's a prolonged period of events, and it can span months, years. And then there's complex emotional trauma, and that is the response to multiple events. And the events may not even be related. And I think of when I started working in the counseling field, and I worked with women in prison, and many times they would tell me about things that happened in their childhood, and then they would tell me about relationships that they had as adults, and they would tell me about multiple events, like of being maybe sexually abused as a child, and then having multiple sexual abuse situations in their adulthood. Because I remember working with my supervisor once, and I said, is it true? I mean, are they telling me the truth? Could one person have had that many events, in one lifetime? And I learned then about how if you have had one event, you often just historically, if you've had multiple events of trauma, you are more likely to have more events of trauma. And
Huh,
I thought that was very interesting
that is
to learn about.
that is interesting.
And so, what are some of the other things that might be able to happen when we screen clients, with an ACE, and that's adverse childhood experiences, So, what are some of the things we're looking for? What are some of those things that might cause trauma?
One I hear pretty consistently is like abuse as a child, so either sexual, emotional, verbal abuse. Those are, pretty consistent
Doesn't
traumas
that
that
make
I
sense?
in life. Like,
I mean,
what do you mean?
it makes sense to me as a counselor when I think now, like if a person that experiences child abuse, especially over a prolonged period of time, that they would have trauma from that.
Hmm. Hmm.
How
Yeah.
we didn't realize that before. I don't know.
Yeah, those are probably the three most common, and then domestic violence is another big one that I see.
Hmm.
Um, I see people for anger management, and a lot of times it's domestic violence, family violence. Sometimes it's legitimate violence that's happened, and sometimes it's, a bad breakup or a divorce that's kind of gone badly, and people are getting accused of things, or, there's an isolated situation that happens. But I think that's traumatic on both sides. I think, for the victim and for the perpetrator, because if you're someone, my thinking is, if you're someone that's not normally an angry person or doesn't normally act out of anger, and you lose it, once in your life, and it becomes like this, it becomes a traumatic experience, because afterwards you have all this grief and you have all these feelings, these emotions, and this regret. And for the victim, obvious reasons, they're the victim of the abuse. In my experience, both sides can be traumatized, if that makes sense.
Yeah, it's actually refreshing to me to hear about perpetrators who have remorse and guilt, and because many times I think the image or what we think of as a perpetrator is somebody that's just cold, callous, has no emotion about it, hurts people, doesn't care that they hurt
Mm-hmm.
people. And especially with, sexual abuse, there's so much evidence that people who sexually abuse have been sexually abused.
Mm-hmm.
And
Yeah.
so it was hard for me to look at a perpetrator with compassion, but it makes sense that if someone is going to be abusive, that there's a reason.
Well, and I think it's what's the saying, hurt people,
Right.
you know.
Exactly.
So sometimes when you've had those experiences and you've had pain and suffering in your own life, it's a normal response to certain situations. And
Hmm.
so you end up hurting people in the process because
Right.
it's just what you know.
Right. And that's I had a I had a nickname in one of the probation offices once because of my empathy and understanding. I had a probation officer that used to call what I do hug a thug and say, "You just want everybody to get a pat on the back." And I think it's important that people realize that, like when I talk about perpetrators of violence having been abused themselves, I certainly don't think that means they don't have a need to experience consequences.
Mm-hmm.
I'm still all in favor of consequences. I just have a real need to understand why people do things. And that's part of the reason I think that it was important for me to kind of drill down into that a little bit and figure out why would someone do that to another person.
Mm-hmm.
And it's their own traumatic experiences many times.
One of the things that I found interesting in my research was community violence and how traumatic that can be. Again, not just on the receiving end of it, but just like with our news cycles and with social media, experiencing, the comments and the feedback and kind of the things that people say and seeing this kind of awful stuff on the news. I personally have had to like detox from the news different periods of time because it's awful to watch
Hmm.
sometimes. And that was one of the things that I read that can be, a trauma experience for people just from watching those things.
Mhm. Yeah, think about, the Uvalde shooting, just how much that I know it affected me so much that I mean, I was up at night sometimes thinking about it.
Mm-hmm.
And my husband and I talked about it a lot and exchanged a lot of links, via text on like, we'll read this article and now hear about what about this one. And because I didn't know anyone involved, but as a human being, just thinking about that situation, it was tragic. It's kind of
Mm-hmm.
like 9/11. How just as an entire nation, it was tragic for all of us.
Mm-hmm.
And I think if we think back in our lifetimes, the first Gulf War was the first time I can recall, like the news media was there all the time. And
Mm-hmm.
I remember 24 hours a day, you could turn on the television and see like the missiles being fired. My husband's going to be so disappointed in me for not remembering what the name of those things were, but the Scud missiles. We would we would watch them going across the sky on the news, and how that's like we do. Just it's in your face all day long, and then you're not there, but you're seeing all that. And then if you have a loved one in the situation, how damaging that is just to seeing it go on all the time.
Yeah, I don't know how you don't get impacted and affected by seeing that on a regular basis. It's just it's hard to watch. And I know people that can't stop watching, and it's a little frightening because that stuff just it wears on you. It affects you, in my opinion.
I think so. I think I don't like to use the word should, but it should. I think
Mm-hmm.
something's wrong with you if it doesn't, that's difficult. And the violence you mentioned in the community, I think about also communities where violence is just right outside your front door and
Mm-hmm.
you don't even feel safe in your own home. That can even be a distressing event that can cause a person trauma.
Yeah, I had a client recently that was living down off Lower Greenville, and I don't know if you remember, but there were quite a few shootings that happened like kind of back to back on Greenville. And one of them happened right outside her apartment. She lives right next or lives right next to a pretty popular club down there, and she ended up moving after a little while because she was traumatized by the experience. She was afraid to go to bed. She was afraid to sit by her windows. She was afraid to walk out to her car. She wouldn't leave at night because of fear of, something happening or getting hit by a stray bullet,
Mm-hmm.
like something that didn't directly impact her, but being in that proximity
Mm-hmm.
and being in that environment, it made it so that she didn't feel safe in her own home.
Yeah. And having that response, that fight or flight response constantly is really bad for our health and bad for our emotional and our physical health.
Mm-hmm.
It's fascinating to me how many things can cause trauma, can cause those really traumatic stress responses.
So secondary trauma that where like you are a witness to it, or it's not directly happening to you, but you're experiencing it
Hmm.
just by being in proximity or
Hmm. And like you and I experience, you more than I now, as being a counselor, you are hearing it, so like that third hand trauma
mm,
where you're hearing about a person's trauma. And when you hear about it over and over and over, that's why we talk so often about the importance of taking care of ourselves, because that information and that just doesn't have anywhere to go can become a little too much.
mm-hmm,
One of them that was kind of interesting to me was medical trauma. When someone, especially as a child, has to have like multiple surgeries
mm-hmm.
or has a really negative experience, in during childhood with some kind of medical procedure, those can last a long time.
My niece was premature. She's had a number of health issues as a result of being premature and has been in and out of children's hospital. And, to see these tiny little beings struggling with these major health crises and having to have
Mhm.
surgeries. And, I can understand how that would be awful and
Oh,
traumatic for a child.
yeah. I remember taking my son when he was 11 months old. He had a hernia. It wasn't a traumatic event. But one of the things I remember is when we took him to the hospital, they gave us one of those little gowns for them to put on, and it was too big,
Oh.
And then they put him on this gurney that was 25 times his size. I was like, that because that's not supposed to happen to children.
Mm-hmm.
The one thing children's hospitals do have those, like they have all the things that fit children, like the
Mm-hmm.
blood pressure cuffs and things. It's just they do such a remarkable job to make it less frightening, I think, to
Mm-hmm.
kids. But goodness, I think the pain that kind of goes along with medical procedures, and a kid, what a just amazing kids they are to have to go through that over and over and over, and some of them come out more resilient,
Mm-hmm.
which
Yeah.
kind of speaks a little bit, I think, to trauma in the fact that there are some people who go through events that another person goes through a very similar event, and one person is life affected lifelong with something like PTSD, while another person is not impacted the same way.
Mm-hmm. What do you think that's about?
Well, what I learned in my time, I worked as a consultant for a treatment center that specialized. Their primary area was addiction, but secondary was trauma. So they treated a lot of people who had addiction as a result of a lifetime of traumatic events. What I learned there was it has a lot to do with resilience. And first and foremost, it had to do with how people reacted around the person whenever a traumatic event happened. So let's say a child is sexually abused by a neighbor down the road, and they come home and tell a parent about it. And the response is, "Oh my God, I'm so sorry that happened. Let me help you in all the ways, we know how to help us take care of that. I believe you, 100%." That person had the very same experience, but the reaction was, that was wrong, that shouldn't have happened. And they do and the adults in their life do all the healthy and right things to help that
Mm-hmm.
child, versus a child who tells and the adult's reactions are unhealthy, like saying that didn't really happen, it was your fault, don't lie like that, Or don't tell me, I don't want to know. We don't want the neighbor down the street to be blamed because he helps babysit you twice a week and I have to work, you know? So
Mhm.
the reaction, so what happens when the child experiences the trauma leads a lot to how they process through the situation because bad things happen in life. They always will. And if we are taught healthy and adaptive coping skills, then we have the ability to, increase our resilience and get through them
All
just
right,
differently.
that makes sense.
It does. It made so much sense to me whenever I heard it because I thought about like people who go to war, like why would one person have PTSD and another person not have PTSD as a result of war? Because war is, I would imagine, difficult no matter who you are. Why is one different than the other? And that's what I came to understand with that is it had a lot to do with the resilience that person built throughout their lifetime.
It's really interesting. So what are like when you experience a traumatic event, most people have heard like the fight or flight kind of mode that kicks in. When I was looking this up, there was one that was fight, flight, freeze, and fawn. And I had never heard of the fawn.
I
Have you
haven't
heard of
either.
that?
What does that mean?
People pleasing, can't say no, prioritizing others.
Oh, so if something happens to me, it's not important how I feel about it. I just
Uh,
want you to be okay.
right. I'm gonna take care of your needs and not my own.
Wow. To know, I'm glad to hear that. I mean, I'm glad to know that information now because that is true. Some people
Mm-hmm.
do. I've
Yeah.
sometimes done that.
Probably have to.
Wow.
Yeah, so fight is your, your anger, irritability, aggression kind of response. So you just get upset, angry about something that happens. Flight is, your anxiety, your fear, your panic, your worrying, your running, basically getting away from the situation is what I think of. This describes it more as like an emotional flight situation. And then freezing, where you're immobilized, you maybe disassociate from the situation. Sometimes depression, things like that happen, but basically you don't necessarily do anything about it.
Mm-hmm. Oh, I do that sometimes too. I think if you were interested in knowing, if you've had trauma, you could look at that ACE questionnaire. It's just 10 questions, and you look at the ages in your life up to 18 years old, and you just answer yes or no. Like, did you ever have a parent or another adult that lived in your house swear at you, insult you, put you down, humiliate you, act in any kind of way that might have hurt you physically or made you afraid that you were going to be hurt physically. So that's unhealthy. That can be traumatic. So, did it happen? Did you have anybody, an adult in the household, push you, slap you, grab you, throw things at you, hit you, injure you, leave marks? Did anybody in your first 5 years touch you, fondle you, touch your body in a sexual way, or attempt to? And did you feel like no one in your family loved you or thought you were important or special? And maybe if your family didn't look out for each other, if you didn't have some sort of close feeling toward family members? And did you often feel that you didn't have enough to eat? You didn't have clean clothes to wear? There weren't people to protect you? Were your parents too intoxicated, under the influence of something to take care of you, take you to a doctor if you needed it? Were your parents ever separated or divorced?
Hmm.
Did you have a mother or stepmother that was ever physically abused? Was there somebody that pushed them, slapped them, grabbed them? Did you ever witness that? Were they ever threatened with a gun or a knife? And did you ever live with anyone who had a drinking problem, had an alcohol or drug problem? And did you live with someone who was depressed or mentally ill? Anyone who ever attempted or completed suicide? And then finally, did anyone in your house when you were growing up ever go to prison? If you have a yes to any of those, then there's a possibility that you definitely at least had some adverse childhood events that can contribute to people who've experienced trauma.
Wow. can answer yes to many of those.
I know. And that's why I think it's so important that we talk about this, that trauma isn't just what we think that it is.
Yeah, those are, I mean, I'm thinking about clients and thinking about, conversations and how many clients I've had that have experienced multiple, could answer yes to multiple of these and myself included. Like as you're reading through these, I haven't taken the quiz, but I'm curious to see what I would score
Hmm.
because there's quite a few that I could say
Hmm.
yes to here.
Yeah. So
Interesting.
many things that occur in our childhood can become something that we perpetuate. So I think that answers a lot of my questions when I had clients who just didn't feel like it was that big of a deal to be on probation. Like
Mm-hmm.
that was just a kind of just a thing. And where when we would talk about it, I would come to find out that being on probation is nothing compared to their experience of adults in their life that go to prison, that they have many adults in their life in prison, people absent from their life for being in and out of jails, and that probation is nothing. It's just kind of a part of being a human being.
Mm-hmm.
And because my experience has not been on probation, or in prison, thank God. So I would imagine like that would have been a traumatic event to be in prison, to go to jail, to be arrested, when the person I was working with said that's just kind of a part of life.
Mm-hmm.
It's just what happened in my neighborhood or in my family. It didn't make my parents upset. They weren't ashamed. It was just like they were waiting for the day the call came for the first time. It's just
Mm-hmm.
kind of how it went.
Yeah.
And so that's the generational events that happen that maybe a person in that situation wouldn't even look at it as maladaptive or unhealthy in any way. It's just kind of a part of how it goes.
So we can talk a little bit about the emotional and physical symptoms of trauma,
Hmm.
starting with the emotional symptoms. So some of the symptoms that you might experience would be, might be fear, feeling helpless. We talked about disassociation a little while ago, just kind of checking out from the situation.
I think that one almost sounds pleasant to me. I mean, wouldn't you want to check out from it? And I didn't understand dissociation as much until I worked at that treatment center that treated trauma.
Mm,
How many people dissociate? I used to think that it was completely like what we used to call multiple personality disorders, that it was a complete separation of personality,
mhm,
where many people dissociate when trauma occurs. Many women who have been raped talk about dissociating during the event just to be able to cope with it,
mhm.
just like feeling like they were watching it happen rather than being present for it. It's just like a leaving of your body so you don't have to feel the intensity, which at the time saves them.
Yeah, I think of like when you've been in a traumatic accident or something, traumatic like that, it's like our brain's way of protecting us. Like you talk about it, but you can't recall, specific details that have happened. You
Hmm.
have gaps in your memory.
Hmm.
That to me is disassociation, and that your brain's just kind of shut down. You're still
Yeah.
there, you're still present, but your brain's kind of protecting you from the intensity of the tragedy, intensity
Hmm.
of the trauma.
Exactly. I was just talking about a situation in my life to my sister last weekend, and she asked me a specific question. I said, "Do you know what? I remember this time, and I remember this many hours later, and I couldn't tell you what happened in between. Maybe one day, as I talk more about it with her or something, I will remember. But I think that that's not abnormal at all for us to just kind of leave
Mm-hmm.
emotionally when something's happening that's too much to handle at the time."
Sadly, that's most of my childhood because of the trauma that I experienced. My childhood is just kind of a black hole. I don't have a lot of memories from being a kid. And that's one of the things talking about sisters and conversations. I always say my sister can remember coming out of the womb. Like she remembers everything in detail. It's amazing. I can't remember anything. Like
Hmm.
I see, videos and things and I don't recognize myself. I don't remember those vacations. I don't remember those situations. And it's sad. It's really sad. But to me, it's because of the trauma I was disassociating to the
Hmm.
point that I just have these huge gaps in my memory.
Hmm. Absolutely. And I think many of us have memories that aren't actually memories of the event. At least me. I have memories of vacations and things based on pictures and stories.
Mm,
Not necessarily, I don't know if my memories are actually of the event or just of the retelling of the event through the years. I think people's memories are different. Maybe I need to do a little research into how people's memories work.
yeah,
But
that's interesting. I've never thought of it that way.
yeah, and we always remember it so differently.
Mm-hmm.
Me and my sister, like we were 5 years apart, but we have different stories and different,
Mm-hmm.
when we talk about how we were raised and stuff, totally different kind of takes on it. I think it was a lot of based on our personalities and how we experienced it.
Mm-hmm.
And I was in trouble from the day I got out of the womb. I was like, I was joking with my family. I was like, my mama, I'm surprised she didn't just wake up in the morning and smack me for what I'm probably going to get into during the day.
Yeah.
My sister, not at all. She didn't get in trouble. She was just behaved differently than me. So we just
Mm-hmm.
had different experiences.
We just got really good at hiding things, and we were doing our own bad stuff, but we got really good at keeping up that false front and not letting the parents know.
Yeah, some of the other, psychological symptoms, mood swings, anxiety, depression, guilt, shame, even as the victim, sometimes we can experience guilt and shame and blaming, other people, ourselves, withdrawing, isolating, losing interest, or just complete, just emotional numbness. And I know there are some physical symptoms too.
Some of the physicals are, increased heart rate, body responses, aches, pains, tense muscles, definitely anxiety. That's kind of more the emotional, but you have the physical side effects of anxiety, just kind of feeling on edge, tense, things like that. Sometimes having nightmares, difficulty sleeping, dealing with insomnia, also being tired,
Mm.
having fatigue from maybe not being able to sleep, or just emotionally spending so much time thinking about the event can cause you to be tired, fatigued. There can be some sexual side effects as a result of trauma. You may see some change in appetites, or just becoming hyper excessively alert and aware
Mm.
of things around you.
That jumpiness or startling easily, I think about where we don't always think about it, like in public. The other day, I heard thunder in a store. I heard thunder outside, and two or three of the people in the store with me went. It scared them,
Hmm.
and I think we don't really think about that, and that's why there are warnings and things that come out around like fireworks time, that those kind of sounds can cause people to startle. We don't
Hmm.
know what it triggers for people.
Absolutely. And one thing when we were talking about PTSD, I had a client ask me this the other day because we were talking about trauma in group. And the question was, how do you treat PTSD? So, what's your 2 cents on that?
I think initially we thought that talk therapy was the best way to deal with it, but actually talking through the trauma and about the trauma sometimes re-traumatizes people.
Mm-hmm.
So some of the kind of cutting edge or current treatments are for it now, or like DBT, which stands for dialectical behavioral therapy, and there's one called EMDR, eye movement desensitization and reprocessing. It's amazing. The facility that I consulted did EMDR, and I sat through a few sessions, and we got to do our own sessions if we wanted, just to kind of better understand it. And it uses lights, movement. Unless sometimes a person will move the therapist will move their hands, and it's a very odd sounding thing. So I don't want to go into a lot of detail. But what the therapist is doing when a person is the patient in EMDR is something that's not possible in any other way. It's getting your emotions to work at the same time as your cognitive skills. Usually when we're in emotion, we're not thinking, and when we're thinking, we're not in emotion. And EMDR somehow almost magically can make both of those brain systems happen at the same time. And as a result of some of those sessions, sometimes only a couple of sessions, people don't respond the same way to the past events emotionally as they used to.
Mm-hmm.
Because I mean, it really is. It's strange sounding, but it really has an amazing and research based shift for people who can really diminish the intensity of
Mm-hmm.
and level of the kind of just disturbing thoughts or stress reactions to things that once plagued them. It's amazing. I mean, truly, if you've never heard about it, do a little more looking into it, or go to Psychology Today and look for a therapist who is actually certified and trained to do it. It's pretty amazing to me, the change I saw in people so quickly.
Mm-hmm. Yeah, I agree with that. I've had some people that have done EMDR, and my mom used to work with a therapist that did EMDR, and some of her clients had just amazing results. Just replacing. My understanding was that it's kind of like you're getting images as you're watching the light, and kind of being talked through that process, and kind of replacing those images with positive
Yeah.
things.
Yeah, and it really does move you from the most intense negative and painful response to something that you can live with. It's
Mm-hmm.
like you reprogram almost
Mm-hmm.
your response to something that was pretty negative. It was just what I loved about it was how quickly it can happen.
I heard it explained also as like our memories are not fully processed, like we're not remembering everything completely, and going through that process of almost like disassociating through the visual part of the practice of EMDR, and then connecting through talking about the trauma, or imagining the trauma and seeing those images, that it helps you process through it completely, and that allows you to kind of then move forward and feel
Mhm.
it differently. It's kind of like I always think about, you just said talking about it can be re-traumatizing, but sometimes it can be desensitizing as well.
Mhm.
I
Mhm.
always think of like my own abuse, and I used to not be able to talk about it without getting emotional and crying. And one of the ways I knew that I had done probably a good amount of work around it was I got to the point where I could talk about it and not cry about it,
Mhm.
right?
Mhm. I think that for addiction treatment, now that we know so many people with addiction have experienced trauma,
Hmm.
it is like finally an answer. Because if someone goes to treatment and they just talk about it and they just get education, that doesn't change addiction. But
Right.
if you can go in and actually treat the trauma, people don't have to keep going back to treatment over and over and over. And it really does make sense to me. If a person stops using, all those feelings come up. What are they going to do with them? So just education is not going to change addiction. Just punishment isn't going to change addiction. Treating the underlying issues
Mm.
changes addiction. I think it is trauma and these things we're talking about. It's so much more than a podcast can address in one episode. So I think it's important that we definitely mention that if you have any kind of traumatic past that you want to work through, find a really good therapist. Psychology Today is a place that you can do that. Just go search for one. Go back to our therapy episode for other tips on finding the right therapist. If you're having any kind of suicidal thoughts, you can contact the National Suicide Prevention Lifeline. Now, all you have to do is pick up your phone and dial 988. You can also just dial 911 if you need to, but always take care of yourself. And, we can't fix it all in just one episode, but we hope this at least gives you kind of just a little bit of information on what trauma is.
I think making the National Suicide Prevention Line 988, which just happened, what, August 1st?
Mm-hmm.
Just went into
It
effect
just happened.
August 1st.
Mm-hmm.
It's a great resource. It's super easy to reach out at this, with
Mm-hmm.
this new 988 number that they have. So
And
definitely
unfortunately,
it's
not everybody, when you call 911, knows what to say to you if it's not like a medical emergency. I mean, if it's not the kind of emergency they're used to, unfortunately.
right. And with 988, you're going to get the assistance of trained professionals,
Hmm.
counselors. It's a great resource.
Yeah.
Well, we hope you guys have enjoyed listening today, and don't forget that knowledge leads to a life lived better. Thank you for listening to Life Lived Better with Paula and Joseph.